we will indeed move on, and this is, I would say, this is it. This is the grand finale. This is a really end edge of the full conference. Although we started already with great talks from Fotis and Malcolm, we are getting now together to welcome Brent Edwards. Here he is. So he's coming from the future because it's Saturday on his end. So it can be better because he's going to talk about revolutionizing audiological care with AI. So it's coming from the future with information that we don't know. So can be better, can be better. So again, thanks, Brent, a lot for being here. I'm sure we're gonna have a lot to discuss in this very last session to put together what we've been discussing during the conference and what you will have to tell us now. So again, welcome. I will get you a little bit of a moment so you can share the screen and get yourself ready. In the meantime, it's just a reminder, put your questions in the Q&A block. If you have, please have a bunch. This, perfect, we're all ready. So again, Ren, welcome. The floor is all yours.
Great, thank you for that introduction. Can you hear me well?
Perfect.
Good. You know, I never thought about the fact that I'm typically a day ahead of everyone in the world, so I feel better about talking about the future. I think also coincidentally, I suspect the sun will rise at some point during my talk, which is also, I think, a nice metaphor for what I'm going to be speaking about here, starting in the dark and ending in the sunlight. So thanks everyone for hanging in here until the very end of the session. Good morning, good afternoon, and good evening around the world. So I'm going to take a little bit of a different tact to most of what you've heard in this terrific conference. And I'm really going to talk about rather than specific details of an application of AI, I'm going to talk more broadly about where I see that AI will be applied in hearing healthcare. I've been in the field now for 30 years, and I've seen a lot of pretty dramatic changes to hearing healthcare. And I'm going to guess that this is going to be as big as digital was, the introduction of digital signal processing was back in the 90s. And there's a lot of concern from people in the field that I talk to, a lot of excitement. But when you talk to audiologists and hearing healthcare professionals, there's concern that maybe they're going to be replaced by AI, or maybe their job is going to change, or their job just won't exist anymore. And so part of my goal in this discussion is to discuss how AI fits into traditional hearing healthcare, and at least my vision for where it's going to be for the next 5 to 10 years. I think predicting beyond that is impossible, since we'll all be run by robots at that point. So I want to start by saying, first of all, that this presentation was not generated by AI. I think this is something you're going to be seeing more and more of as a disclaimer in presentations in the future. And so let me just make that clear from the beginning. Or is this presentation completely generated by AI? And I want you to think about that for a second. Suppose I just told you right now that everything that I'm saying was created by ChatGPT, and I'm actually reading a script from the screen right now. None of this is my own words. I'm just a human voice for AI at this point, and the rest of the talk will simply be listening to ChatGPT. What do you think about that right now? What is your perception about the rest of this talk? Are you as interested in it? Now, just as likely, what if I'm actually not here? What if this is actually an avatar that is quite realistically represented by AI, including my voice, which has been sampled, and now which is a pretty authentic representation of myself. And I'm actually still sleeping because it's only 6 a.m. or so here in Australia. Would you care? Would you care about the content that I'm about to talk about? Would there be a problem with the trust that you would have with the content and the insights that you're going to hear from me, but may not actually be from me, could be coming from an AI system. How do you think about that? So, and I want you to think about your reaction to the possibility that you're simply listening to AI right now, because that is the future of healthcare. And that is going to be the future of hearing healthcare in some sense, where AI starts to make its way into um, care of every aspect, whether there's a health professional in front of you who's relaying information from AI, whether they're using AI information as a part of their counseling and diagnostics, or whether it's directly coming from an AI system. All of these are going to happen in the future. And how people think about this, how patients think about this, and whether they will trust that information is going to be a very important factor in the integration of AI into healthcare. It's not just a matter of building it and people will come and people will use it. There's a human component in here, and people are starting to look at what are all of the aspects of trust when it comes to healthcare and the integration of AI into medicine. And there are a lot of issues that have to be addressed before it can, I believe, and a lot of experts believe AI can be effectively integrated into healthcare. And that's going to be the same with audiological care as well. Anyone who's talked with a patient or an audiologist knows that the relationship between the patient and the audiologist is very, very important in the treatment, and whether someone actually will use their hearing aids, whether they'll get the benefit from the hearing aids. That human experience is critical in the success today of hearing aids. What happens when AI becomes a part of that relationship? We don't know, but we can predict that there are going to be issues, several of which that you see here on the screen. Also, in recent research, people have looked at general attitudes towards the use of AI. In this case, whether what people feel about the use of AI to diagnose and administer medicine for bedridden patients. And you see the responses by age groups here, where the light blue are people who actually think that's a good idea, and the dark blue are people who don't like the idea at all. And you can see that for people over the age of 55, the vast majority of them don't like the idea of AI administering medicine and determining when that medicine should be given. Now, the average hearing aid wearer is in their mid 70s. The first average age that someone first gets a hearing aid is about 69. So now imagine how this data would look if they actually extended it to older ages. And you start to see some of the challenges that all of us who are developing AI solutions in hearing healthcare are going to have in getting its acceptance, not only by hearing care professionals, but also by the patients and the end users of audiological care and hearing devices. So uh, it's more than just a technology, I think, is the takeaway on that. So I'm gonna stop and just give you a definition of AI so we're all on the same page here. You know, there's a lot of different definitions out there. I picked the one from IBM because they are probably fairly legitimate. But I have a problem with this definition. I suspect everyone at this conference does as well, because most of the definitions out there talk about AI as mimicking human intelligence and human capabilities. And I think it's pretty clear from this conference and other applications that AI can far exceed human capabilities. And if AI were simply mimicking human capabilities, it wouldn't be that interesting. And I think in hearing healthcare, you'd say, well, forget it. Why do we need AI when audiologists are doing just fine? And it's the ability to perhaps exceed the capabilities today that really makes this interesting. And of course, we're seeing AI changing every single field, and it's going to change our field today. So why the sudden increase in AI over the past several years, where suddenly almost every single day, certainly every week, you read about something new? Well, over the course of the past half of a century, uh, starting in the 1960s, you can see this axis here. The y-axis is representative of the capability of AI systems. And you see it sort of follows Moore's law by and large, doubling in capability every 2 years. And something happened in around 2012 where the capabilities of AI systems were doubling every 3.5 months. And I'll mention in a second why that is. But what does this mean? It means that back historically, we would see about an eightfold improvement over a 6-year period. Now, with the doubling every 3.5 months, we're seeing a 2 million-fold improvement every 6 years. So the advancement is extraordinary. And that's why for this conference every year, you're going to see very different things than what you saw in the previous year, unlike many other conferences where quite often you see some of the same things over and over again. So things are moving very fast. And if you look at healthcare specifically, this is the most recent data of how many medical devices the FDA in the US has approved that has AI integrated into it. So it's just growing and growing, and you can kind of see where the trend is here and probably where the numbers are for 2024 and will be for 2025. If we look more specifically on what areas of healthcare AI is being applied, well, we can predict where that the majority of it is going to be by looking at where the capabilities of AI is more generally. So if we look at the this top curve here is image classification. So AI has always been extraordinary at image classification, as you've heard from others in this conference. And so it's no surprise that this is where we see the vast majority of applications of AI in healthcare, specifically in radiology, which looks at X-rays, fMRIs, and things like that in order to diagnose conditions. And so most of the applications to date, in fact, I looked at all of the FDA-approved medical devices from 2024, and almost every single one is radiology. And if you want to know where we are in hearing, that would be under ear, nose, and throat. And so far, there's been one. And I haven't gone to look to see which one that is. It possibly has absolutely nothing to do with hearing and could be some other aspect of ENT. But it's coming and it's catching up because as you've heard at this conference, there are a lot of people working on the application of AI to hearing impairment, and to hearing healthcare, including our research organization, which you've heard a couple talks about here. Now, as a representation of where image recognition has been quite beneficial in healthcare, the first medical device for clinical diagnostics was approved by the FDA was for a device that identified diabetes-related retinopathy, which is basically taking an image of the retina and with a trained ophthalmologist being able to identify whether they have this disease. Now AI can do it with the accuracy of the best ophthalmologist in the world. Now, when I talk to audiologists who are concerned about losing their jobs over AI, I ask them, do they think that ophthalmologists suddenly were scared that they were losing their jobs when this device appeared? The answer is absolutely not, because they're not exactly proud of this talent. This isn't what gets them out of bed at night. This rather becomes rather rote and boring for them. And they would rather probably not do it and spend more time counseling with their patient and doing more complex aspects of eye care. And I think it's the same in hearing. There are certain rote aspects of audiological care that, quite frankly, you don't need someone with a PhD or an AUD or whatever the certification is in your country in order to, say, for example, do an audiogram. And why not offload some of these aspects of hearing care, let AI do it so that the hearing care professional can spend more time with complex cases and spend more time with the counseling and getting people successful with treatment strategies. So given that AI is so good at imaging, and it's one of the best things that it's successful with, I thought, well, where does imaging have a role in hearing healthcare? Well, one obvious, if you kind of observe what happens when someone goes to get their hearing tested and possibly a hearing aid, it's when the audiologist reviews the audiological chart with the patient and starts to explain what's going on with them. So here's a fictional chart here that someone may use to explain the results of tests to a patient. And I simply uploaded this to ChatGPT with no pointing to special documentation of how to interpret this and said, explain this to me like I'm a 70-year-old patient and you're a trained audiologist. And basically, it did an excellent job of explaining each of these areas. And this is a direct quote of the summary that ChatGPT gave to me on how to interpret this that I can take away. And it's pretty good. So AI can do a pretty good job at understanding the data and making recommendations. But again, that goes back to the trust issue. Does that mean all of a sudden now we don't need the audiologist sitting there? Absolutely, you do. There are a lot of aspects to getting people to understand what's going on with their hearing, getting them to accept a treatment strategy and know how to understand the benefits of their strategy of their treatment in order to make them successful. We know this from decades of research and just practice. And you'll see later on some research that we're doing at now that incorporates AI in that counseling to try to make patients more successful with their devices. So, we can often in hearing health, we can understand our future by looking at what's happening in other areas of healthcare, because quite often hearing health lags other areas of healthcare for whatever reason. So if we look at where AI is being used in other areas of healthcare today, there's a variety of applications that are all fairly common sense. Training practitioners, so using it as a way of educating and then testing hearing healthcare students and or updating actual practitioners with the latest information using large language models, using data to triage patients, so taking access to big data, understanding the unique aspects of the patient in front of you, and getting to a quick screening of what should we be thinking about with this patient. In hearing healthcare, we're looking at this in large big data and AI in order to determine who is most likely to be successful with hearing aid treatment. Because just because someone has a hearing loss doesn't mean that they want a hearing aid or will benefit from a hearing aid. And vice versa, we're doing a lot of research on people who have not much hearing loss at all, but could actually benefit from a hearing aid and have significant hearing needs. So the application of big data to give you an instant understanding of that patient in front of you and lead you down different healthcare paths is one of the applications of AI here. Obviously, diagnosing conditions where you take all aspects of the patient and apply some sort of diagnostic tool to them, and then determining the treatment, again, based on large data of millions of patient treatments, and importantly, the outcomes of those treatments. You have to understand not just what was done with them, but how successful was it in order to incorporate AI into that treatment strategy. Um, you know, Assisting with admin work, clinical case notes is an obvious application here we're seeing across all of healthcare, where audio is being recorded and transcribed into text and then fed into large language models, which are then summarizing the discussions between the doctor and the patient, and also putting data directly into medical health records, electronic health records. So, and that relieves a lot of the burden from hearing healthcare professionals, including audiologists. And then finally, AI can also help the patient when they've left the hospital or the clinic by incorporating sensors and other ways of tracking the behavior of the patient and using neural networks as a way of understanding what's going on and are they on the right track? The treatment's working? Should a red flag be raised based on what's being said with the sensors? And again, this would all come from trained networks. And again, this is something that we're looking at now as well, which I'll mention near the end. We can also look at non-healthcare areas to see how AI has progressed in fields that are more advanced than us and have moved much more quickly. Automobiles is an obvious one where AI has been incorporated and has dramatically changed the automobile field over the past decade. And you can see this one researcher has sort of categorized the progress of AI, the integration of AI into cars in a variety of ways. On the left-hand side, you see various stages of the integration of AI where the human is still basically quite closely involved with the system that the AI is helping with. Where, in number one here, you see that's, perhaps just monitoring your speed, monitoring the lane you're in, and beeping if you start to veer out, to actually starting to take some control, such as maybe slowing down if it detects that there's the potential for an accident coming up. To over here where they really start to take control over the driver. And I think the same progression is going to happen in hearing healthcare, where you start to move from the left and AI becomes more and more integrated first, just to in the background advising the hearing care professional. But eventually, at some point, AI is going to start to take a little bit more control of hearing healthcare, and may actually do some tasks that the audiologist would normally do but doesn't have to do anymore. I don't think anyone believes that in healthcare we will get to point number five, where basically AI is in complete control anytime in the next probably at least decade. Again, it's really hard to predict anything in technology these days beyond that time frame, but not for the near term do we see that sort of complete takeover of AI. So, I mentioned this inflection in the capabilities of AI. One is the use of GPUs and just the hardware in order to be able to run these neural networks very fast. The other access is the other big change is the access to big data. And certainly Malcolm has seen, this progression in his days at Google, where, access to YouTube videos and things like that have really exploded capabilities in speech recognition. Same in hearing healthcare. So I kind of see three different areas where we have access to big data. One is in the hearing aid device. Others are in the sort of the clinical data. And then finally, big data in audio. We're seeing really transforming hearing aids just over the past year that have been introduced into the market. So what data am I talking about from hearing devices? Well, you could actually say AI has been in hearing aids for, I don't know, probably 15 years or so, maybe longer. When Siemens first introduced a hearing aid that monitored the user's use of volume control buttons, and basically learned under what acoustic conditions, and they would turn the volume up and turn the volume down, and would start to do it automatically for the person. Now, that wasn't a neural network, but it was basically, it mimicked what AI was in replacing the capabilities of and the needs of the human. Where obviously the audio coming in from hearing aids is important. Looking at the how the hearing aids are functioning, and data from that with the Bluetooth connectivity between hearing aids and phones, you have access to a ton of data now in hearing aids that tell us about the use and presumably the benefit that the user is getting in the real world. That, again, because of the connection between hearing aids to their phone with Bluetooth, and then from the phone back to the hearing aid manufacturer through the cloud, that data is being mined and is being used in order to produce better hearing aids and have a better understanding of the use of devices. There's a lot of data that a lot of organizations have on patients, whether it's demographics, diagnostics, treatment strategies, their success metrics, and that's because of standardization in the electronic data in use of hearing aids with NOAA on that captures patient data, and then each hearing aid company has their own software where they see how the hearing aids are being fit to that unique patient. We now are part of an organization that has over 180 clinics, over 200,000 patients that are being helped every year. And so we have access to millions of data sets on patients, diagnostic data, demographics, what devices did they use, how were they fit, how successful have they been, did they return the device, how long did they wear it, and so on. So there's a lot of data if you can get access to it, and only very few organizations have this capability to get that kind of data on a very large scale. Then finally, I mentioned the data from speech and audio that is leading to audio enhancement. We've seen over the past year at least two major hearing aid companies, I guess probably three now, that have used millions of audio recordings to train of speech and noise, realistic speech and noise recordings, in order to train onboard neural networks on the hearing aid to do speech enhancement in noisy situations that are quite extraordinary. You know, the first, I remember about 5 years ago hearing a demo from some Google employees, I think, at Icon in Lake Tahoe that almost seemed like magic in its ability to source segregate and isolate single talkers. Hearing aids can do that now. Um, Not nearly as well as desktop computers and more powerful systems, but they're actually doing it. So, which is extraordinary given the limited capabilities that computational capabilities that hearing aids have, and limited by size and the fact that they run off about 1 milliwatt. So, you know, it's AI is going to revolutionize hearing healthcare in a variety of ways, including the audio processing, but not just the audio processing. And again, the focus for our research at NAL and you know what I'm talking about here is AI transformation in the actual practice of hearing care. Large language models are also going to have a dramatic effect on hearing healthcare. And obviously, we're very early days in this because of the only recent introduction into widespread use of large language models. And if you look at the number of publications that mention LLMs in PubMed before the year 2023, it's amazing that there are even any. One publication, 2019, two in 2022, and then over 1,000 last year. So they are full steam ahead in the application of LLMs into healthcare and certainly into hearing healthcare as well. Again, there's going to be an issue with trust, but also an issue, again, the human factor of how you actually integrate LLMs into healthcare. This was a study done on 50 physicians to see how well the physicians were able to diagnose patients when they incorporated GPT-4 into their diagnostics. On the right, you see the sort of the success of the patient diagnosing a complex case just on their own without AI. The middle, you see how well they did when they incorporated ChatGPT into their diagnostics. They didn't do any better. In fact, GPT-4 alone, without the human involved, did a better job diagnosing the case, and it got worse once the human started applying its expertise. So we've got a ways to go to figure out how to incorporate AI just into diagnostics. Doesn't mean we're not going to get there, we will, but it's not just a matter of making the technology work. It's a matter of figuring out that squishy interface between technology and humans and how to get the holistic whole of the two working on this. So, why do we need AI in hearing healthcare? I think I've talked to a lot of people who have said, well, you know, we're doing just fine. You know, hearing healthcare is a well-established field. We don't have any need for AI because we've got trained audiologists who know what they're doing. Um, don't need it. Thank you very much. Keep it out of my clinic. Well, this is a quote from the Australian government's Department of Health, but it's a quote that could be easily applied anywhere in the world. And basically, it's saying that there's going to be and there is an explosion in the need for hearing healthcare thanks to the baby boomers, thanks to the growing number of people in the age demographic of, you know, people over 60 who need hearing help and will need hearing devices. And the thing is, there is not an equal growth in audiologists and hearing care professionals. So you start to see this is a graph of the need for audiologists over because of this growth in the population. This is what perfect would look like if the number of audiologists matched the need. This is the trajectory we're on in terms of number of audiologists that we expect to grow. If we assume audiologists can say start to become more efficient and see more people, then maybe they can start to make up the need. But there is going to be a gap between what patients need and what hearing care professionals can provide. And AI can help with this and will help with this. And if it doesn't help with this, there will be other solutions to providing hearing care that circumvents the audiologist and doesn't require the diminishing capabilities of the audiologist to meet the need. This is one example with over-the-counter hearing aids. This is a photo I took at Costco, where you could buy hearing aids right beside Fitbits and computers and iPhones. No audiologists involved. Apple recently came out with the capability to turn your AirPods into proper FDA-approved medical devices with a quite accurate hearing test now embedded in the iOS. So if the hearing care professional and the hearing care field doesn't change in order to meet this growing need, other organizations, there will be other ways that will provide solutions here. So that is why we need hearing care, AI in hearing care. So just real quickly to finish up here, the application of AI at now. Pretty much everyone who's a researcher at now has been involved in AI in some way in their research. You've heard a couple projects in this conference already about AI. A couple others that you may not have heard about. We're taking something called the COSI, client-oriented scale of improvement, and which now developed 27 years ago and is in use around the world. It's a way of counseling patients and understanding what their needs are so that they can better appreciate the benefit they're getting from hearing aids. We are taking millions of data sets of COSI data that we have, and we're developing an AI system that can be more effective in counseling and getting people to appreciate the benefit of their hearing aids. So I'll just skip through the client pathway here. But again, we're taking millions of COSI data you see here and training systems and agents that will then understand what is the best application of COSI in the clinic that produces the best outcomes for patients based on the data that we have. You heard about virtual personas from Nikki earlier today, so I won't get into those at all, except it is the application of large language models in training of audiologists on the soft skills, which are so important in order to get hearing aid wearers successful with their devices. We are in the middle of releasing the next generation fitting prescription, the most widely used fitting prescription in the world. So when someone gets a hearing aid and they get their hearing loss measured, our prescription tells the audiologist how much gain should be provided at each frequency and at each level for that audiogram. We developed the first one 49 years ago. The most recent one, NAL-NL2, was released 15 years ago. And so we're coming out just now. In fact, we're shipping our first beta to licensees on Monday with this technology. And one of the big improvements here is the application of very sophisticated AI. So again, we have access to millions of audiograms, millions of hearing aid fittings, millions of real ear measurements that we are using in order to help us come up with better targets, gain targets for patients in order to make them more successful. So again, there's a deep neural network in here, very large data, and we're producing better targets, and we've done a lot of clinical trials in order to demonstrate that the outcomes with patients are better with this more sophisticated and more accurate approach to fitting hearing aids. So I think I'm kind of at the end of my time here. So I think I'll just end with reminder of where we see the use of AI in healthcare. And maybe I'll give the last word to AI itself. So Carrie Recker, a very smart audiology researcher a couple years ago, asked ChatGPT itself, where it thought AI fit into hearing healthcare, and probably crossed her fingers that it wouldn't say, we're going to replace all of you. So these are there's this conversation was quite long. I'm just showing you what ChatGPT said to the question, how do you think AI will improve patient outcomes in hearing healthcare? This is direct quotes from ChatGPT back then, probably will say the same thing now. And it's sort of similar to how we've been, what I've been saying and how we've been thinking about it. It's really tools to assist audiologists in diagnostics, uh, providing basically personalized medicine based on the large data that it can access to understand the needs of the patient in front of them. It can also be used to monitor and track how patients are doing over time once they leave the clinic. It can be used to make predictions about the future. Is this the kind of patient whose hearing loss is likely to progress faster than others? And should they come in for a hearing test every year and help the audiologist counsel the patient on care? And finally, it can automate some tasks, clinical case notes, and other things. Again, it all makes sense. It's not scary. This is actually just going to be another tool in the toolbox for audiologists to provide better care. But I think the real need for it is this growth in the population of people who need hearing help. And we need hearing care professionals to be more efficient, more effective in being able to treat more people. And for some people, maybe even self-care. So I will leave it there and thank everyone for your attention. And hopefully this has been had some useful information for you.
Brent, I'm not sure that there was a better way to kind of wrap up the whole meeting. I think you put together a lot of things that were discussed during these 2 days. So again, thank you so much. I think you really came from the future and shake our brains a little bit here. So I hope your avatar is ready to receive some questions, though. I don't know if that's part of the thing, but really,
Meep moop, I'm ready.
okay, perfect. Okay, let's go to a couple here. I'm sure there are plenty more to come, but the first one that I read here, it's I think kind of you mentioned that even you close a little bit about it. But based on trends, isn't AI going to take those more interesting jobs as well as and do they so sorry the AI going to take those more interesting jobs as well and do them better eventually if it is going to stay and do it better than the audiologists and take the actual
So,
jobs. I think you
so
talked.
well, first, I think there's a question of what does better mean. But and again, I'm just going to speak to the next 5 to 10 years because it could be AI replaces everything beyond that. But I think over the next decade, we can't underestimate and undervalue the human interaction in hearing care. Audiologists see patients many, many times in order to get them successful with their devices. It's not just a matter of here's the audiogram, here's your hearing aid, it's programmed, done. There is a lot of counseling, a lot of confidence building, a lot of explaining, a lot of expectation setting, a lot of matching the needs of that unique individual to the person. And again, there's a trust issue. And right now, I think for the next decade, there's going to have to be a human involved, unless this is a kind of person that wants to do it themselves. And here's where I think AI can be really beneficial. I think there's a lot of people, probably younger, people in their 50s who are still working, who have some hearing loss, but they just don't want to go to an audiology clinic. You walk in, you're surrounded by people who are in their 80s. That's not me. I want to do it myself. I do everything myself. That's where I think AI can help with the tests, with treatment, and help people who want to do it themselves be successful. But I think for when you have a serious healthcare condition, most people want to see a professional. They want to see a human that can give them the confidence that they're on the right track.
Good. Okay, we'll keep going with one from Jan Willem here. Did you use AI agents to assess what the NL3 gain would be optimal as an evaluator?
We didn't. We relied on humans to determine whether it was actually beneficial. But obviously, there was AI played a very important part in creating the target um, based on the optimization algorithms that we had. Part of it too is there's multiple criteria to determine the targets: loudness, speech intelligibility, a couple other things that in order to implement it quickly on a audiologist software, it was much more beneficial to train a neural network to do it basically instantaneously. Not a lot of people know this, but NL2 15 years ago actually used a very small neural network in its application. And that actually caused some of the problems that it was kind of small. You had a lot of edge cases where it just didn't do the right thing. And by having more sophisticated networks, we're able to sort of get it to be more successful for all of the audiograms that we've looked at.
I see. I will go for one more here. Regardless AI, I think you touched also on here on this topic. How do you think hearing healthcare will look like in 20 years from now?
Well, what would hearing healthcare look like in 20 years? Look, when I think about what is the future is different segments of people getting different approaches to hearing care. Right now, we treat everyone the same. We give everyone the same pathway. We give everyone the same solution. Go see an audiologist, take a Houston Westlake audiogram, get a hearing aid that's a RIC or a CIC that does multiband compression and noise reduction. Everyone gets that, but different people have different needs. Some people are going to want to do it themselves. Some people might want to use AirPods and not traditional hearing aids. Some people might want, I don't know, some solution no one's thought of yet. So I think we're going to see a segmentation of the patient journey, of treatment strategies, diagnostic approaches. The traditional path will still be there. The 70-year-old is, I think, going to want to see a human, and we're going to have our gold standards for hearing healthcare that aren't going to change that much. But revolutionary approaches are emerging to help people who don't want that traditional gold standard approach for whatever reason. And that should be okay. We shouldn't force everyone into the same channel if they want a different solution. So that's kind of where I see the long-term future, which we're not there yet.
I will go with the last two questions. One is from my
Maybe can
end.
I ask this question myself, Seba?
The last one that you have there,
Yeah?
let's do it after this one because
Good, you go first.
is the president, is the director question?
Yeah. Because Brent, you completely convinced me that the null workforce is open for AI, while maybe the audiology workforce has more resistance to AI. So, given that preference and openness for null people to work with AI, do you think an AI agent would be an excellent director of null?
Hey, it could certainly assist me in many ways that it isn't right now. But I think there's also a human factor when you lead an organization that I think is also important in terms of understanding the needs of the organization and motivating and giving people confidence. So right now, I think humans are still necessary, but they can certainly be augmented by AI in my role.
Thanks.
I have one question from my end. I'm coming from developing country, which is Argentina. We not only from there, but from the last piece of it, which is Patagonia, where many places like this lack of resources, and they don't have a lot of places, a lot of things, a lot of clinics, rural places, people around with not much, but people with hearing loss, right? And people with need assistance. So I wonder your thoughts and your words on how do you think AI and all these technologies are actually going to close a little bit the gap that we need actually, because we discussed a little bit about I'm in the University of Miami. It's great. AI is going to improve a lot of things, but it's just something on top of something good. In those places they are lagging behind and they're very bad in many places. So I wonder your thoughts about that area.
No, yeah, I think you're absolutely right. That gap I talked about that's emerging from the growing population and the lack of growth in audiologists, that exists today in terms of region. So, in Australia, we see that, we're a country as big as the US, but the population of only 25 million. So we have a lot of towns without audiologists. And AI can absolutely play a role in providing treatment where audiologists just can't get there. We're seeing that right now with pediatric audiology in Australia, where a researcher at University of Sydney has developed a tool to take a look at images of the eardrum and diagnose otitis media automate with AI. So you don't need an expert out in all of these rural regions where sometimes 90% of the kids have otitis media because of the circumstances of that location. And so AI is actually, I think, it's a huge opportunity to provide healthcare in hearing and else and other kinds in regions where the healthcare provider just isn't there. So you're absolutely right.
So I think this whole discussion said just bring more questions and more to think and more to learn. So again, Brent, we are so thankful for you to be here. I think, again, as I mentioned before, there's no other best way to close the whole 2 days of information that we gather here. So again, thank you, Brent, very, very, very much. And I think with that, we can move, again, thanks. We can move to the very last part, which we're going to announce a couple things. So like, where is next VCCA going to be? Who are the winners of the money that we have to give to the awardees? So stay tuned.